Welcome to PT Curate, episode number deuce. All right, this article is titled A Novel Automated Text Messaging System is Effective in Patients Undergoing Total Joint Arthroplasty. You know what I hate about TV? Commercials. That's why I'm a big Netflix and Amazon Prime guy. You know what I hate about physical therapy? Having to leave my house. How dare you, physical therapists? Anyway, why don't you just send me some text messages and I'll get it all done. All joking aside, this article is actually pretty interesting and resulted in some pretty good outcomes. I'm not sure how it would work with every caseload. Everybody's a little bit different, obviously. I am going to link this article, or at least the abstract, down below so you can take a read. So as the title kind of explained, this is messages being sent to patients who have undergone a knee and hip replacement. The author is Campbell KJ et al., and they mentioned that the purpose of the study was to evaluate the effectiveness of a text messaging bot with respect to patient engagement following joint replacement procedures in a randomized controlled trial. So skipping down to the results, you can see that there was a 20% increase average in exercise time, which was from a jump from 37 minutes to 46 minutes on average. The patients also improved moods using the visual analog scale by 1 point. That went from 6.5 to 7.5. The one that really jumped out to me was that there was a 10-day decrease in narcotic use. The text message group stopped on average at 22 days post-op, whereas the standard or the control group went to 32 days. There was an average decrease of 2 calls to the doctors during this time, which went from 0.6 on average to 2.6 in the control. And although there is greater knee range of motion seen at 3 weeks in the text messaging group, both groups reached the same knee flexion range of motion at 6 weeks. So again, this might not be for everybody, but it definitely has its purpose, and it is going to be affecting our patients for the good. Obviously, there's some good results here, but it's something to keep in mind as we move forward in this profession. The title of this article is Recovery of Knee Flexion with Unsupervised Home Exercise is Not Inferior to Outpatient Physical Therapy After TKA, a randomized trial. I want to start off by saying that this won the 2018 John N. Insall Award. John Insall was a orthopedic surgeon who made a lot of improvements in the surgery world, and there's, I believe, 4 articles every year who receive this award, and that allows the authors to enter into different orthopedic surgery units and really have access to a lot more resources. Now, the reason I wanted to start off by saying that is, one, I think we can recognize this article as a quality article, but I don't have access to the full article because I don't make enough money from this YouTube site, so like and subscribe down below, and maybe I will in the future. But the results are a little bit hard to understand, which we'll get to in just a moment here. So the patients, let's start off with the patients being randomized into 3 groups. One group was standard outpatient PT, which all of us should know well. The other was a web-based platform, which was WebPT, which is unsupervised by a physical therapist. The last group was an unsupervised printed paper manual, which was provided by Paper PT. Now that we get to the results, we can kind of see how it's not really cut and dry in this abstract, but I think we can get the idea. I'm going to read this word for word. Adjusted differences in change in passive flexion for WebPT was plus 3 degrees, and Paper PT was plus 5 degrees, which were not inferior to outpatient PT on a predefined 5-degree margin. Reading that, it makes me believe that WebPT might have been 2 degrees less. However, this is likely not a significant margin of change, so we can't chalk this up to anything but possibly inter-rater differences. Change in knee flexion from baseline was 0 degrees for outpatient PT, minus 2 degrees for WebPT, and minus 1 degree for Paper PT after 4 to 6 weeks, and 8 degrees, and 12 degrees respectively for the 3 groups after 6 months. Additionally, there was no difference in the change in the knee outcome score for baseline at 4 to 6 weeks or 6 months postoperatively, as well as time back to work, driving, and walking without an assisted device. So after reading this, it kind of makes me think how often we, as physical therapists, create a frequency of 3 times a week for our knees and hips. And I definitely think that some people will need that. However, can our time be better used treating other people who might need the 4 or 5 times a week, especially early on in their therapy program, where we might be able to reduce the frequency a bit earlier with some of these knee and hip replacements? Patient first language, gotta love it. So possibly dropping those individuals down to 2, maybe 1 time a week sooner than later, as long as we can confirm that they're following a program. If there's something you can set up, whether it's having the front office call or if there's an email that they can send you to say, I did my exercises, just to make sure we're keeping up track with everything, I think that would be worthwhile. And this all comes on the heels of the drop of reimbursement for physical therapy and the more that have been proposed coming. We all hope that those don't come, but there has certainly been, from what I've seen, an overabundance of physical therapy provided and patients educated to come more frequently than probably is necessary, as well as decreased quality of efficient care. And I just think it's something that we can all get better at and help us as physical therapists selfishly make a little bit more per hour than maybe we do currently, but still providing this an improved level of care to our patients is where our profession hopes to go. The first article we have for today is titled Additive Effect of Therapeutic Ultrasound in the Treatment of Plantar Fasciitis, a Randomized Controlled Trial, and that's by Katsup et al. So, not a huge fan of ultrasound myself, but always want to keep an open mind. Found this article, it came across my eyes about 3 weeks ago, 3 weeks ago, but it's an article actually from about a year ago. The article mentions 2 previous studies that were done for the treatment of plantar fasciitis via the use of ultrasound. They stated that the first one used 0.5 watts per centimeter squared with 3 megahertz at 25%, which they concluded was not deep enough to actually do anything. The second article that they referenced used 2 watts per centimeter squared with 1 megahertz at 100%. However, the providers of this article held the transducer statically for 3 minutes at each pain point, which is not a common use for ultrasound, despite ultrasound not being common use anymore. The authors of this article, Katsup et al., hypothesized that 1.8 watts per centimeter squared at 1 megahertz 100% for 8 minutes may result in better outcomes. The conclusion to this study was contrary to the hypothesis. Ultrasound didn't improve the symptoms. The authors now recommend excluding ultrasound from plan of care for plantar fasciitis.